A culture for evidence-informed decision-making in Uganda, and our panelists are already here. It is a fireside session, so the audience will participate, but mostly it's going to be a conversation. In our African culture, as you heard from Adeline, I think yesterday, mentioned something about it, about her grandmother, putting them around the fireplace to tell conversations. So we're going to have a conversation between practitioners in government and also an evidence intermediary, talking about how they've tried to foster a culture of evidence-informed decision-making. Please welcome our panelists and our moderator. I'm going to hand over to our moderator, Dr. Kasiliye Ibrahim from the APRSC at Makerere University. Thank you.
Thank you very much, Ismail. Good morning, ladies and gentlemen. I wish to welcome you to session 7 of this conference. At this juncture, I wish to invite our panelists. First, Mr. Vincent Tumusiime, who is the Director of Socioeconomic Monitoring and Research at the Office of the President. Then Madame Josephine Watera, who is the Assistant Director of Research Services at the Parliament of Uganda. And then finally, Mr. Edward Kayongo from ECAS. I will briefly introduce them. The first panelist, Mr. Vincent Tumusiime, is working for the Office of the President as the Director of Socioeconomic Monitoring, and is in charge of a very unique institution or secretariat called the Secretariat for Public Policy Execution Oversight Forum, codenamed the Apex Platform. So he will be talking to us regarding that this morning. Madame Josephine Watera is the Assistant Director in the Department of Research Services in the Parliament of Uganda. She's worked there for a considerable duration. She's also a member of the Uganda Evaluation Association, and parts of which she will talk about this morning. And then we have from our very own Edward Kayongo, who will be talking about evidence intermediaries. To kickstart us off, we all know, as was indicated in some of the sessions yesterday, that evidence-informed decision-making is important, partly because in a number of African countries, decisions are not guided by evidence, but in some instances are guided by political factors, and political factors change quite dramatically from time to time. Nonetheless, quite a lot of people are left out if decisions are not guided by evidence, and some of the people left out are the most vulnerable. So this morning, we have a session that's going to look at how specifically government institutions use evidence and how the non-government institutions, evidence intermediaries, also use the various strategies and capacities to promote evidence use. I will start with Mr. Vincent Tumusiime. In 3 minutes, could you explain to us how the Apex platform is used to guide evidence decision-making within the Office of the President, as well as the wider government policies and programs? Thank you. You will need to use your mic, please.
Thank you, moderator. Good morning, participants. I've already been introduced, and I've been given 3 minutes to explain what I do in the Office of the President, specifically through the Apex platform. Apex platform, as the moderator has already indicated, is a high-level public policy management forum. And it's one of the key reforms that was introduced in NDP 3 for effective implementation of government policies. So what we do is we try in as much as possible to gather information from various stakeholders, including the beneficiaries and institutions that have been implementing, say, policy or program or project. And over a period of time, say 5 years and above. So what we do, we try to trace how that policy has been effective or ineffective, and try to identify what has been achieved and what has not been achieved by gathering information through primary data, secondary data, and then also doing a thesis of various reports that other key stakeholders come up together, right from the implementing institutions, the civil society, the independent researchers, and even just press, world views, and then we gather them together with insights. We come up with reports which we subject to validation by various stakeholders. Then we present them to what we call a pre-apex, where we bring all key stakeholders to come and validate the kind of information that we have come up with. And then we use what we have come up with to make actionable recommendations, which are then subjected to another panel called the steering committee, chaired by the head of public service. And then from there, we come up with concrete recommendations that we think could change policy or influence policy. And then we take them to cabinet, and cabinet pronounces itself on either policy reviews or dropping policies or advocating for new policies. Basically, that's all we do. Thank you.
Thank you very much, Mr. Tumusiime, for that brief about Apex. I'll come back to you. Josephine, from the vantage point of the Parliament of Uganda, as well as your other engagement with the Uganda Economic Association, could you please, in 3 minutes as well, explain the extent to which the Parliament of Uganda is guided by evidence-informed decision-making?
Thank you very much, and good morning. Parliament has different structures that facilitate the generation, translation, and use of evidence processes. So besides the research department that I'm going to talk about a bit more, there is also the Parliamentary Budget Office that gives evidence that relates to the national budget and its expenditure. There is the Office of the Legal Department that provides legal kind of evidence, because we also go with evidence-based legislation processes. And then there is the Leader of Opposition's Office and Leader of Government Business. By the way they sound, they produce evidence that is biased to those offices that they're in. The Research Department will be celebrating 25 years next year, and we offer independent advice and evidence-based information to committees and individual members of Parliament in form of policy briefs, in forms of position papers, in forms of field-based reports. So we undertake primary research on specific issues of concern, and this can be proactive or on request by the committees of parliament. And we also do policy briefs and bill analysis. So when a bill is introduced in parliament by the executive, we undertake a detailed bill analysis to ensure that this is well informed. And what are the other aspects that we've opened up so that we can work with others and facilitate this process better? So we have a partnership with the UBOS, Uganda Bureau of Statistics, that provides us statistical data when need arises. We also work closely with the EPRC, where ISMA is based, to get independent assessments that come from outside. We work with ECAS for rapid assessment on issues that emerge also for committees. They have been very instrumental during the COVID times. And we have other partnerships also with, like also the NURU, is the National Union of Research in Uganda. On the side of Uganda Evaluation Association, so I'm wearing two hats today. They facilitate the process of capacity building. So the staff of the department are institutional members of the Uganda Evaluation Association, and so they facilitate the learning from that side. But also when we have the Uganda Evaluation Week, for example, we usually have parliament and members of parliament come to talk about what they do there. Lastly, I'll just mention in 1 minute now, we have the UPNOD Uganda chapter, the Africa Parliamentary Network on Development Evaluation. So I've talked about the technical side, but this is the political side that advocates for use of evidence. It involves members of parliament, and in a way it's also to raise momentum for them to appreciate why evidence is important in their work. Thank you.
Thank you very much, Josephine. Edward, what is ECAS and how does ECAS perform the functions of an evidence intermediary?
Thank you very much. So my name is Kayongo Edward, and I'm a senior research scientist at the Center for Rapid Evidence Synthesis. For those of you who are not from Uganda, welcome to Uganda. I hope you're enjoying your stay. This is the Pearl of Africa. So when you go back home, just be sure to mention you are in the Pearl. It's really beautiful. So about the session, so ECAS is basically a group of individuals who are so much interested in evidence and the use of evidence to inform policies and decisions, not only within Uganda, but within the region and Africa at large. So basically what we do is twofold. So we play the role of knowledge intermediaries or knowledge brokers, but we also undertake primary research when it comes to evidence-informed decision-making. I'm going to talk about that too, independent of each other. So as a knowledge intermediaries, basically we look for the evidence wherever it is, package it in such a manner that we make the information available to the policymakers and supply this information to the policymakers who end up using it to inform the policies and decisions. So we use the rapid response mechanism in getting this evidence into the policy space. Basically, the rapid response mechanism ensures that we get timely, relevant, and contextualized evidence to support the urgent need of evidence, and we define urgent as a decision that is going to be taken within 28 days. Within means it can be from 0 days to 28 days. So maybe something to note here is that that decision is going to be made within 28 days and not necessarily that the evidence is needed within 28 days. Where the difference comes in is that a policymaker can come to you, they tell you they need the evidence within 2 weeks, but the actual policy that is going to inform is going to be within 2 months or 3 months. So the policymaker has this perceived urgency for need of the evidence, but in reality, it is not really urgent need. So in that case, we usually refer the policymakers to some other groups that provide the evidence within longer than 28 days. So our major interest is that we have limited resources and we should be able to meet these urgent needs where the decision is within 28 days. So that is basically what we do on that end. Some of the products we produce include the rapid response briefs, we have citizen briefs, we have policy briefs. Now, for the policy briefs, it's usually longer than 28 days. It's difficult to produce a policy brief within 28 days because here you're going to provide evidence that spans across the entire policy question, from what the problem is, from the available options for solving this problem, and then you also have to provide possible implementation strategies for the different options, and also provide the cost-effectiveness analysis. But for the rapid response brief, it is usually a very targeted question. A question could probably be focused on understanding what the problem is, or understanding the different available options for intervening in a particular problem, or ways of implementing a particular option that has already been chosen by the policymaker. Sometimes, though rarely, we get questions on cost effectiveness. Usually our cost effectiveness comes in the broader policy briefs, not in the rapid response briefs. Then on the side of primary research, ECAS usually tries to be at the forefront of innovations when it comes to evidence-informed decision-making. So in this, we always try to understand how better can we provide the kind of service that we provide to the policymakers. So we keep exploring, trying to understand the policymakers' needs, trying to understand how better we can package this information, how better can we build trust between the knowledge intermediaries and the policymakers. Because at the end of the day, our relationship with the policymakers is based on trust. They have to be able to trust that you're going to provide evidence that is relevant to their policy process, but also unbiased evidence, and you are in position to deliver the evidence as and when it is needed. Otherwise, if you fail them on that front, chances are high the policymakers will always regress back to what they used to do without you. Because either way, whether you're around or not, the policies will have to be made. Whether they're informed by evidence or not, the policies will be passed. So you have to make yourself relevant, build that trust. So there is always that ongoing research from our end to try and understand some of these aspects. Packaging of the evidence is really important. Different policymakers need the evidence packaged differently. It is not always the same thing. You need to be able to come up with innovative ways in which you can package this evidence. So you always have to keep thinking, planning, think more like a primary researcher, but also think more like an evidence synthesis specialist at the same time. Okay. So in a nutshell, that is really what ECAS is.
Thank you very much, Edward, for that brief regarding ECAS. I'll go back to Vincent. How can the government support evidence-informed decision-making within its structures and processes, either within the Office of the President, but also outside the Office of the President for the departments and agencies for which you provide oversight?
Yeah, thank you. I think the government of Uganda has supported that because of, mere approving, for instance, the Apex platform, an institution that brings together institutions of government that are at the center of program or policy, project conceptualization, planning and budgeting, implementation, and then also the office that is in charge of implementation. Then again, creating a platform to synthesize all the evaluations that have taken place from different aspects to try and understand how an intervention has been effective or not. To me, I think that's one way of supporting the culture of evidence. But another one is also encouraging collaborations between the state and non-state actors to be able to utilize the findings of the non-state actors and then use them to inform or guide government policies. I see that one is also another way of supporting the culture of use of evidence. Basically that.
Okay. Thank you very much. To Josephine, how can researchers or other interested parties take advantage of the available pathways to engage with and support evidence decision-making processes?
Okay, thank you very much. I will start with what happens within Parliament, and then I'll cross again to Uganda Evaluation Association. So within Parliament, whenever Parliament is going to sit, we have what we call the order paper, which will be like agenda, but in terms of Parliament language, it's called the order paper. And this order paper is made open, it's accessible by the public on the website before the sitting of Parliament. Actually, the rules of Parliament now provide that the order paper for the week that follows is prepared a week before. So today is Thursday. By close of day tomorrow, we should be able to have the order paper of what business is going to happen in Parliament next week. So this gives our evidence generators and producers an opportunity and a kind of a roadmap to know what business is coming in the House and therefore what they need to do about this. So that is what happens in plenary in terms of the debates and the preparations for plenary. And we have another avenue in forms of committee system. So all our committees are open. We operate an open committee system for purposes of drawing in citizen evidence and also research evidence that comes from institutions. Like I mentioned, one here is the ECAS itself. We work so closely with them. And the committee, when we're having, for example, a bill before Parliament, they usually run in the newspapers an advert calling on anyone interested party or key stakeholders, primary and secondary stakeholders in this bill. If it's an issue of land, if it's an issue of, let's say, road safety, if it's an issue of environment, education, health, there are key players in this area who have already, specialized. So they'll reach out to the public generally in the newspapers, but also the committee will write, targeted invitations to stakeholders in civil society organizations and research bodies to come and give feedback on this bill that is before Parliament. So it's also another way of opening up for them to come and participate. The last one is about petitions. So the public has the open platform for petitioning when there is an issue that is happening and they think that Parliament is not moving fast. They can bring a petition through the office of the Speaker, and this petition is fast-tracked, and it will usually summon the side of the executive to show cause on what actions are being taken and what needs to be done in terms of hearing also from the petitioners on the issues that emerge. Let me just mention that in Uganda we have the whistleblowers law, and so in a way it also provides an avenue of people who want to remain anonymous to provide information in Parliament, and they are protected. So when people bring information and they prefer being anonymous under the Whistleblowers Act, nobody's going to victimize them and come after them. Let me mention also the last one now on the side of Uganda Evaluation Association. We've worked closely with the Office of the Prime Minister, setting up the mapping of practitioners and evaluation professionals in the country so that we get to know who is where in terms of skill base. And then we work also together at the end of the month. Every last Thursday of the month, we have the National Evaluation Talks, and we bring people with different methodologies to come and share their experiences with members of the association, and it's open, even others, so that we get to know what is happening out there, and in a way we grow together. Thank you.
Edward, how can knowledge brokers like yourselves position themselves better to engage with and support decision-making processes? She's already mentioned you are working with the Parliament of Uganda, but how can you better engage with institutions beyond Parliament as well as Parliament?
Thank you very much for that question. And I should say it is one of the things that we constantly ponder over and keep thinking about how better to do this. But currently, the strategy we are using at ACAS is building relationships and trust. Yesterday, we had a lengthy discussion about relationships. But at the end of it all, what is really most important is for the policymakers to know that they can trust you to provide unbiased evidence, so that they can trust you to provide that evidence when it is needed. So how do we go about this? One of the basic things we do is inviting policymakers to attend conferences like this one. We have several policymakers who are attending Evidence 2023. Then we also invite policymakers for breakfast meetings. These are usually short meetings, probably like 2-3 hours, where we talk to the policymakers, tell them about what ACAS is, what ACAS does, what kind of service we can offer to them. Maybe something I hadn't mentioned, ACAS uses a demand-driven strategy. We rarely do horizon scoping. We usually prefer for the policymakers to come to us with policy questions, because that way we are almost sure that the evidence we are going to provide is going to be used to inform a policy or a decision, versus if you push the evidence to the policymakers, you are external to the process, you're just coming in with your evidence, which they didn't ask for, so it might not be used. So in all the efforts we undertake is to try and show the policymakers how to identify questions that need evidence, because literally speaking, all policy processes require evidence. But how would you get the policymaker to appreciate that they need evidence? And how are you going to get them to appreciate that there is a difference between a primary producer of evidence, a difference between a content expert and a KT practitioner, a knowledge translation practitioner? You need to be able to get the policymakers to that understanding of all those differences, because some of the policymakers have experts, they have numbers of content experts. So if they're talking about cancer, they'll pick up a phone call in Parliament, call someone within the cancer department at Makerere, within Mulago National Referral Hospital. They get evidence. Such evidence from an expert is usually biased with the expert's opinions and lived experiences. So you need to get the policymakers to trust you. I think the key thing here is relationships and trust. The ways in which you're going to build the relationships is what is going to differ. The other strategy you use for building relationships is using evidence champions among the policymakers. So you'll find that you have a policymaker you've worked with for probably the last 1 to 3 years. So you're going to work through that particular policymaker who is already converted to believe in evidence and evidence-informed decision-making, to introduce you to his other colleagues. That way you get a more soft landing compared to if you come out of the blue and you're trying to set up meetings. Sometimes it will be a little bit hard. Then we also use policymakers during our breakfast meetings and dissemination workshops to talk about their lived experiences working with us, to fellow policymakers. So here you have someone from the policymakers' end talking about you to fellow policymakers. So in one way or another, it further builds the trust among the policymakers you haven't worked with previously, to know that you actually provide a service that is good because it is one of them talking on your behalf. Then the other strategy that we rarely use, but sometimes we go to it, is trying to use the top-bottom kind of approach. If you know a minister, a permanent secretary, sometimes you work through them to get the different departments to push questions towards ACAS. The challenge with that is that many times, if you use that kind of approach, the people within the policy analysis units or the commissioners and the like, they might ask the questions simply because their permanent secretary has instructed them to use the service you're offering. It does not necessarily mean that they will be able to use the evidence. So that is an approach that is still a little bit shaky, something that we need to further think about and modify, but it is also one of the easiest ways to use. But at the end of it all, I think it is relationships and trust that would push the use of evidence further within governments and ministries. The very basic example is our work with Vincent and Josephine. So with Vincent, we've worked with him for 3 years now. Yeah, so we've worked with Vincent for like 3 years now. We've participated in different reports that have gone to the Apex platform. So right now I can comfortably say that Vincent trusts the kind of work that we do. His unit is already sending questions to ACAS, and we are sure that evidence is being used because we've attended some validation meetings within Apex. Josephine also keeps talking to us and asking us for evidence. That relationship is built on trust. So that is what I can say. Thank you.
Thank you very much. Just to take you back, so what happens when policymakers don't demand for this evidence?
Very good question. So we've had a few scenarios. So I'll give an example of COVID-19 global pandemic. So at the beginning of COVID-19 global pandemic, as ACAS, we felt like we had a big role to play in shaping the direction the country was going to take in addressing the global pandemic. However, in the first, let's say, 1 to 3 months of COVID getting to the country, because I think we recorded our first case of COVID around March 2020. So there was a panic, like in most of the other countries globally. So government rushed into lockdowns and the different things that were done to try and control the pandemic for COVID from spreading within the country. I can't really say it was the best strategy or not, but we were left out of the initial stages of the decision-making process. So it was now up to us to tap into our connections within the Ministry of Health to try and push the people who are at the decision-making table to come and request for the evidence from us. So we worked through evidence champions. We worked through one of our directors, Professor Nelson Sawankambo and Dr. Rona, who have deep roots within the Ministry of Health. We had one of the professors at School of Public Health who was on the committee that was directly reporting to the president. So we had to look for those particular individuals who we could approach and tell them, you know what, we are still available, we can still offer that service. We also had to work through some commissioners that we had previously worked on other questions, and they were not directly involved in the response to COVID-19, but they could get the evidence to the decision-making table. So at the end of it all, you try your level best to ensure that you have constant demand. And as I said, at ACAS, we also have the primary research angle to it. So we keep thinking of innovative ways on how to stimulate this demand and keep the questions flowing, because we still need to support evidence processes, decision-making processes with evidence.
Okay, thank you. Vincent, so many institutions have talked, they are working with the Office of the President, but could you explain to us the funding mechanisms available for the promotion and use of evidence in government policies and programs?
Well, we basically don't provide funding as Office of the President to gather evidence from the partners we work with. For instance, ACAS, we make a request on a topical issue, and they use their own available resources, and they give us the kind of information we use, and then we build on that to push it further to cabinet. But we have also tried to make some bit of networking and collaboration with agencies like UNDP, where we source for funding of some studies, and UNDP has helped us on funding some studies that at least gives us some information to build on as we search for evidence. And but for the ministries, like for instance, the Apex framework is built on the concept of the policy life cycle. We look at the institutions that have been implementing, that have conceptualized the interventions we are trying to examine, and then those that are in charge of planning and financing, and those in implementation. So those institutions, we require them to use their resources, but in some cases, we also complement specific studies within institutions which are targeting a certain topic that we are looking at. And once that one is produced, it becomes now a collective document that we sponsor. But basically, the funding mechanism we use in APEX is basically through networking and collaborations with institutions that can fund their own studies and those that we can co-fund partly for specific studies, not for every work we do. Thank you.
Thank you very much, Vincent. To Josephine, what are some of the different strategies available to strengthen the governance structures that can support systems for evidence-informed decision-making?
Okay, thank you so much. And I'll speak broadly because I am in the government, circle, in the broad approach that the government has taken. I will start with the national M&D policy. And so this sets a path or a framework upon which we are setting up evidence, both on the side of the data itself, but also the personalities, the resources, the persons, and the data. And then I'll go to the National Technical Working Group, the National M&D Technical Working Group. This is like a gatekeeper. They undertake peer review of evidence pieces in forms of evaluation reports that government has produced. And before this gets into cabinet, the National M&D Technical Working Group does the kind of sieving. So whether this has been undertaken by an independent evaluator or by an institution, this technical working group supports this process of repackaging and refocusing the findings so that they can be used better by the cabinet, where I'm also a member. I will also talk about the government annual performance report. So it's a whole of government approach to performance assessment, and it's also evidence-based on how different sectors in the country are performing, and also the findings that come from here get through cabinet, and it's a very influential process. They're actually having their meeting yesterday and today that informs the next budgeting and planning for the government. I will also talk about the Civil Service College. It is in charge of capacity building, so this is also another strategy that the government has undertaken. It's in charge of capacity building for the M&D cadre. And recently, in the month of April, the Public Service approved operationalization of the scheme of service for the M&E cadre. So this is going to help us to put in place the relevant personalities and specialities of individuals to facilitate evidence use in the country. Within the Parliament of Uganda, like I said, we have members who are already in the association of the Uganda Evaluation Association, but also our team is highly multidisciplinary. So when we have an issue that, just one question that you asked, Vincent, issues of funding, when we have an issue that we think we cannot handle within Parliament, we actually have a small budget, I'm calling it small, to reach out to specialists who can give us, a quick, rapid assessment of a specific issue of concern so that we are not having any gap when need arises for information. Thank you.
Thank you. Before I move to the wider plenary to pose questions to my panelists, Edward, does ECAS mobilize resources to support demand-driven, evidence-informed decision-making exercises?
Okay, thank you. So ECAS runs on grant money mostly for the kind of service we offer. So the reason as to why our service to the policymakers is free, not necessarily free because someone is meeting the bills, that's usually the different funding institutions. But the policymakers, the reason as to why our service is free for them, it's because we are trying to build a culture of evidence-informed decision-making within the country. So if you tag a cost to the service, chances are high you're going to deter many of the policymakers from coming to you for the evidence because they don't have the budget for that. You already had Vincent and Josephine talk about the little resources available within their different units. It is the same across the entire government. We do not necessarily have a different docket of money that is set aside for evidence to police within government. So we try our level best to ensure that we lobby for funds from different sources, mostly through funding institutions. Then we offer the services to the policymakers at no cost.
Okay.
Thank you.
Thank you. I'm now going to open it up to the members in the audience. Anyone who would wish to pose a question to any of our panelists. I'm going to request some help in moving the mic, please. So, first, second, and third.
Thank you very much. Such a great panel and for all the experiences shared. What I would really like to ask, maybe it goes to ACAS. And when you were talking, you talked about having innovative ways of presenting the evidence. So what I really want to ask is, what are those innovative ways? Because I work with a policy research institute, so we basically do what ACAS does. And mostly ways of synthesizing the evidence is usually has to do with maybe policy brief, position papers, like those kind of shorthand notes. So I really want to know other innovative ways that you present your evidence. And then now also we would want to know how rapid is your rapid? Like when you say rapid assessment, what does it really mean to provide like rapid evidence to these policymakers? Thank you very much.
We'll take two more before I ask the panelists to respond. He had his hand up here, and as well as the gentleman in the middle.
Thank you so much. Good morning, everyone, and the fellow panelists. My name is Serge Yakudiam. I'm the co-chair of Indigenous Networks. It's a global movement of indigenous evaluation practice worldwide. So we cover Africa, Asia, and North America with the First Nation in Canada and North America. So a very interesting panel, especially when we have decision makers on the board. And then I really enjoyed the discussion, but I want to know one thing. What is the boundary, or not the boundary, but what is the connections has, regarding a country management, you have a little flow of data, flow of information coming in, and then you have to select very specific information or evidence information to take a decisions. Is there within, but I didn't see where you talk about something like knowledge management office, where you get those flows of basket of informations, or let's say databases, where we stock all those data, and then took time to go back and analyze and synthesize and look about the key information you will need to take a decision, especially for Josephine and the chairperson. So how do you manage that? Because it didn't come very clear within your discussions. How do you process and get key information people are looking for to say that you do this, we decide on that? Thank you so much.
Thank you very much. In the middle, right.
Thank you. I'm going to ask a question on behalf of an online participant. Mm-hmm. Thank you for the opportunity. The question is, where is the evidence published for others to use? That's Joanita Nalunjoki, who is asking as an online participant. Thank you. Where is the evidence published maybe for others to be able to access? I'm sure mainly to ACAS, I think you are publishing a lot and doing a lot, but maybe where do the people who are interested in following this evidence access them?
There is also a gentleman right in the middle there we've been missing. Yes, please. Please go ahead.
Okay, my name is Remy Ayede. I'm Research and Optic League at the Partnership for African Social and Governance Research, Nairobi. My really concern is In the many years you have worked with policy communities, how would you say that there has been, or you have catalyzed a change in the culture of the use of evidence in government or any other organization that you have worked with? Because you have talked about, your role, but the ultimate will be to get to a point where government or policymakers are searching for evidence and contacting organizations like yours or ours to help them with solving problems.
Thank you very much. You'll be the last, then.
Yeah, my name is Maxwell Bano. I'm from Ghana, working with an NGO called Tere, based in Bogatanga in the Upper East region. Was a very informative session. I would like to know how receptive is government when evidence is presented to them. I'm asking this question on the background that there are times governments put up some project in a community and then the people will not use the facility. And so when you have organizations like ICA, my organization, generating evidence and presenting it to government, and then these evidence are in the interest of the people, all right? And then on the other side, you find government implementing projects that are not participated by the citizens. And so how receptive is the government when evidence is presented to them? Thank you.
Thank you. There was a lady here. She will be the final one because I'm mindful of the time and we could have another round if we have time. Please.
Thank you. My name is Gloria Anderson from Tanzania. I just have a very straight question. How is the engagement of the policy beneficiaries, like the citizens or the young people? Where are they being included in the whole process of implementation and the making? That's what I want to know, because recently there has been a lot of fights, especially from my country. The parliament is presenting matters and everybody's like, where is this coming from? A lot of contract policies and all that. So I just want to know from the experience of Uganda, how are you guys engaging them so they don't feel left behind? Thank you.
Thank you very much. I'll go back to my panelists. Several questions were raised. I'll start with Edward. There were several questions posed to you. Please.
Okay, thank you very much for these very good questions. So I'll start with a question on the innovative ways of presenting the evidence. So first and foremost, we do the very basic, the reports. So ours are rapid response briefs. So within the structure of the rapid response brief, it has the first page that has the summary of the key messages that we want to put across to the policymakers. Then after that first page, then inside the rapid response brief, there are all those details in case the policymakers wants to read more. The most important thing is that summary of the first on the first page, because sometimes our policymakers are too busy and they're not going to read a 5-pager. So if you can give them the first page, that is perfect. Then we've also piloted the use of easy-to-read policy profiles. So the easy-to-read policy profiles, they are a little bit different from the rapid response briefs and the policy briefs. So these ones just present the entire evidence in form of bullet points with the use of a few cartoons here and there to break the monopoly of bullet points. So we've piloted this kind of structure on 2 different policy dialogues so far, where we provide the policymakers with the easy-to-read evidence profiles, then also provide them with either the rapid response brief or the policy brief. And compared what we've seen with the policy dialogues, where we provide the usual kind of evidence. And to our surprise, for these policy dialogues where we presented the easy-to-read policy profiles, evidence profiles, the policymakers are more informed heading into these dialogues. So it is basically because you've given them all the information they need within a form of bullet points, and the policymaker will only go to the bigger document to try and expound on a particular bullet, which probably they think they need more information about. That is the other way we've done it. Then when it comes to the citizens' engagement into the policy process, we started off using citizen briefs, which is more or less the same as a rapid response brief, but easier language. But we've moved on to using illustrations, which we are terming illustrated evidence profiles. So the illustrations have mostly illustrations with minimal to no words. In that, the citizens, when they interact with this evidence in form of illustrations, they can easily pick the message you're trying to send across. And if you're going to engage the citizens in an informed discussion, they also come to the discussion table informed by the evidence you've already provided to them. There are key questions about how we produce these illustrations and whether we are sure the illustrations communicate, but we go through a rigorous process. So we usually get a team of illustrators. These are not permanent members of ECAS, but we co-opt them every time we are going to do such an exercise. So we get the illustrators to come in, give us the first round of illustrations. We get the ECAS team to interact with these illustrations and do different modifications to them. Then we get citizens and bring them and ask them to tell us what they understand from the illustrations we are providing them with, right? So from the kind of feedback we get, we know what needs to be changed, or the citizens tell us if this is the information you want to present, then this illustration should be twitched to depict something different. So after you go through all that process, then we use these illustrations to engage citizens in an informed discussion. Then finally, this is something we are just starting out sometime this year, and probably I can put it out here because very soon we are going to reach out to the different evidence teams within this room. We are going to try and pilot the use of audio for evidence. So instead of providing the policymakers with all these beautifully written documents, how about if we transform this evidence into audio in form of a podcast where we have someone asking questions, another person responding to the questions. So if the policymaker is driving back home and they are in jam, they can play this audio on their radio, and by the time they go through 30 minutes and hour of traffic, they've already interacted with the evidence more than you could probably it would take probably longer to read the evidence profile or something like that. Okay. This is something we are going to pilot, but we are going to reach out to different teams to get them to engage with us so that we can collect rigorous data to compare how this is going to, the impact and how this is going to work out. So I've just let the cat out of the bag, but definitely before the conference ended, we are going to talk about this with the different teams. But that is something that we are also going to try out. So as I said, we keep thinking and trying our level best to see how best we can do this. So more ideas will always keep coming up, but so far, those are the things that we are really trying out with.
Okay, thank you. I'll go to Vincent. There were several questions raised, ranging from what are the knowledge management processes, how receptive is government, and so many others in a minute or two.
Yes, I think I will try to use an example of a recent study we have conducted and how we have done it. Hopefully that will answer the issue of inclusivity, where the youth coming in and others, and also it may partly answer your concern of how other various stakeholders contributing to the knowledge management. So under the Apex framework, we have what we call eco-knowledge management system, whereby we, like for instance, in this case, we did a study on commercialization of agriculture and its impact on local economic development. We're trying to find out what interventions have gone into commercialization of agriculture over a period of 13 years. that is from 2010 to 2023. And we are trying to trace to see what has gone there, what has worked, what has not worked, and what needs to be done in order possibly to achieve the intended objectives. So in the process, we had to conduct primary data. There was a diagnostic study funded by UNDP, which we built on, and then we got some primary data to try, because the diagnostic study was basically based on the secondary data, but we had to go and down and also collect some evidence from where those interventions went. And we collected some information through talking to the beneficiaries and conducting some group discussions and picking some information from the leaders in the countryside. And then when we came up, we are tasked, like in government, we have various institutions charged with different mandates. For instance, Ministry of Finance mobilizes funding and allocates. So we asked the Ministry of Finance to get us all a compilation of all the intervention, the funding that went into interventions to promote commercialization of agriculture in the local economic development. So they gave us all the kind of money that was spent even on other related interventions that were meant to promote commercialization of agriculture. Then we have Office of the Prime Minister, which basically coordinates implementation of government programs. So on a yearly basis, they conduct performance evaluation of those interventions. So they gave us information from their own perspective on how the interventions have been appraised on a year on for the last 13 years. Then we tasked National Planning Authority to give us the milestones in the National Development Framework. Then we tasked the EPRC, we tasked these other stakeholders, the ISO, for instance, that is the Internal Security Organization, to also get us their own information. We read the work of Josephine in that specific sector. So we integrated all this and synthesized and came up with a report which we subjected to all interested groups, including the youth, women, and the farmers. And from there, we came up with key recommendations that we pushed through up to the steering committee, and now the report is ready for cabinet to pronounce itself. So first of all, that's how we gather information from key stakeholders, then we publish it. After cabinet has pronounced itself, it can be found on the website, and certainly we shall run press briefs on what outcomes came out of that, and that's how we manage. So if you are looking for that kind of information, you can always find it on our website. So we publish by putting that kind of information on the websites. We publish by putting some highlights in the press, and also by having documents in terms of series 1, series 2, series 3. So those documents are there. If you're looking for that kind of knowledge, you can find it, which is an integrated knowledge. Then there was an issue of is the government effective in utilizing evidence that is brought to it? I would say yes. It is not only, is it in Ghana, where some interventions are abandoned, and then you bring information to government. We also have the similar situations here. So once we get that kind of information from even the whistleblowers, as you have heard from Josephine, we try to find out what exactly is the problem. What are the underlying causes of this kind of thing? And quite often you find that possibly the beneficiaries were not consulted when the intervention was being formulated. So when you put it there, certainly people can't use it. So we come and try to influence change of policy in terms of how we conceptualize and formulate our projects, and then we come up with various policy guidelines on how we should approach. And I think finally it was the issue of inclusivity from my sister there, which I have, I think, talked about, because we try in as much as possible, especially at the pre-apex level, when we are validating, we try to call all various categories of stakeholders to come and participate and share their views on how best we can promote or maybe shape a recommendation that will inform policy for effective results.
Josephine, in 2 minutes.
Thank you. Yeah, let me just pick two and then I can hand over back to you. The issue of where is the evidence published. So for the government is the government evaluation facility, the general reports that come from the evaluations. But for the parliament, especially the research department, we have a portal, drs.parliament.go.ug/8082. And when you put this in your URL, you'll be able to see the different reports that the department has published. So what we do a one-pager document called Hot Topic every week, and we divert members of parliament through this hot topic to this portal. So we'll pick a report on a specific issue, let's say road safety, talk about it, and then tell the members, put a link and say the full report on this can be found on this portal. And then on the voices of the young people, so Parliament of Uganda is very well structured in terms of representation. So we have youth as a special interest group that is represented in Parliament. So whenever issues emerge that relate to the youth, we use these special interest groups as the voices of the people. So just to point out that as we try to advance evidence, the evidence is important, but also who is talking is also very, very important. So we try to identify these evidence champions so that they are the ones who speak with the evidence that we have given to them. Thank you.
Thank you very much. I'm going to give each panelist a maximum of 1 minute to give us their recommendations on how to make progress going forward. I'll start with my most immediate neighbor, Edward.
Thank you very much. So what I would say from KT practice point of view is that we should just ensure to keep on building relationships with the policymakers. And where possible, let us try to formalize these relationships. In any engagement, there is the role of the informal kind of approach to a relationship, but also the formal one really plays a key role. As ECAS, we've previously entered an MOU with Vincent's office, the Apex platform. We have an MOU with them where we are going to keep on working with them on different knowledge products to try and support decision making. We also have an MOU with the Ministry of Health. So these MOUs have their role they play in the relationships, but also don't throw away the informal kind of relationships, because informal sometimes plays a key role in this, because not every time someone is going to send you an email. Sometimes someone just wants to send you a text. Sometimes you're going to meet the policymaker probably for coffee or at a bar, and if you don't have an informal kind of relationship, they'll never approach you with a policy question. So just the policymaker seeing you somewhere, they should be in position to approach you because you've built this kind of informal relationship with them. Then you can be able to support more and more of these policy and decision-making processes within government.
Thank you very much, Edward. Josephine, your final word on how we make progress in a minute or less.
I encourage us to keep engaging, that one time, one day, your evidence will be picked up. But even as you engage, be timely, be relevant, and be focused on what you want to influence. Thank you.
Vincent, your final word.
Yeah, networking, collaboration, and creating platforms for knowledge sharing, I think are very fundamental in the use of evidence.
Thank you very much. Unfortunately, we've run out of time. I wish to thank our audience, the physical audience here, as well as the online audience for the engagement. A very big hand clap to the panel this morning. Thank you.